Greetings. I am Dr. Karl Nath, the Editor-in-Chief of Mayo Clinic Proceedings, and I am pleased to welcome you to the multimedia summary for the journal's August 2024 issue. There are 3 articles that have been selected as our Editor's Choice or Highlights articles this month. Our Editor's Choice this month is an original article entitled Blood Calcium, Genetic Risk and Risk of Incident Kidney Stones, a population-based cohort study. It is authored by Dr. Ji Cao and colleagues from Tongji Medical College of Shuazhong University of Science and Technology in Wuhan, China. Kidney stones contain calcium in the majority of cases, are increasing in frequency, and are predisposed to by diverse and increasingly recognized risk factors. Such risk factors include urinary characteristics, for example, low urinary volume, hypercalciuria, dietary intake, for example, high salt intake, high animal protein intake, dietary supplements, assorted diseases, for example, hyperparathyroidism, and structural abnormalities in the genitourinary tract. Conditions such as hyperparathyroidism predisposed to kidney stones by causing hypercalciuria. Cao et al. Questioned whether blood calcium per se, and independent of hyperparathyroidism, is a risk factor for kidney stones. To examine this issue, Cao et al. Utilized the database of the population-based UK Biobank. Cao et al. Also used this database to address another relevant question: is there a genetic susceptibility to kidney stones? The current literature demonstrates that specific genetic diseases, for example, primary hyperoxaluria, predispose to kidney stones, and specific single nucleotide polymorphisms are also implicated in such risks. Cao et al. Undertook a concerted approach to genetic susceptibility by developing a polygenic risk score based on 40 relevant single nucleotide polymorphisms. Analyses undertaken by Cao et al. Were based on 3 groups of blood calcium concentrations, with low, moderate, and high calcium concentrations representing the first, second, and third tertiles, respectively. The polygenic risk score was also separated into 3 groups, with high, moderate, and low polygenic risk score. The data demonstrate that patients with high and moderate blood calcium, compared with those with a low blood calcium, had a higher risk for kidney stone formation. Interestingly, there was a nonlinear correlation between blood calcium and kidney stone risk, with an upward inflection for increased risk occurring even when blood calcium concentrations were in the normal range. Participants with high and moderate polygenic risk score compared with a low polygenic risk score had an increased risk for kidney stone formation. Moreover, there was a joint cumulative risk for kidney stones with a higher blood calcium and polygenic risk score. This important study by Cao et al. Adds to a current understanding of risk for incident kidney stones by uncovering the potential contribution of blood calcium itself, by underscoring the potential contribution of genetic determinants, and by demonstrating that additive risk may accrue when genetic susceptibility coexists with higher blood calcium concentrations. Our first highlight this month is an original article entitled Cardiorespiratory Fitness as a Predictor of Non-Cardiovascular Disease and Non-Cancer-Related Mortality in Men. It is authored by Dr. Joshua Sparks from the University of South Carolina in Columbia, South Carolina, and colleagues from Louisiana State University in Baton Rouge, Louisiana, the John Ochsner Heart and Vascular Institute in New Orleans, Louisiana, and the University of South Carolina, Columbia, South Carolina. Substantial evidence supports the beneficial effects of cardiorespiratory fitness in non-communicable diseases such as cardiovascular diseases and cancer, with such diseases accounting for some 70% of annual mortality. Sparks et al. Questioned whether cardiorespiratory fitness is also associated with reduced mortality caused by non-cardiovascular diseases and non-cancer related mortality. These investigators addressed this issue in men who were followed at the Cooper Clinic in Dallas, Texas between 1971 and 2003 for preventive medical evaluation. Cause-specific non-cardiovascular diseases and non-cancer deaths which were evaluated include those due to diabetes or kidney disease, chronic respiratory diseases, acute respiratory and infectious diseases, and other non-cardiovascular disease, non-cancer deaths. Cardiorespiratory fitness was assessed by maximal treadmill graded exercise test duration and classified as low, moderate, or high cardiorespiratory fitness. The data demonstrate that individuals with the highest cardiorespiratory fitness exhibited the healthiest profile as assessed by BMI, blood pressure control, glycemic control, and serum cholesterol. Such individuals were at the lowest risk for all-cause, non-cardiovascular disease, non-cancer mortality, and disease-specific mortality, including diabetes and kidney diseases, chronic and acute respiratory diseases, and infectious diseases. The implications of this seminal study by Sparks et al. Is at least threefold. First, it demonstrates that the benefits of cardiorespiratory fitness extend beyond cardiovascular diseases and cancer to a number of other diseases such as diabetes, kidney disease, and respiratory and infectious disorders. These salutary effects of cardiorespiratory fitness in men, as pointed out by Sparks et al., is especially notable as men, compared with women, have higher mortality and are generally more at risk for chronic diseases such as diabetes and kidney disease, and for age-related decline in cardiorespiratory fitness. Second, among physiologic pathways that are recognized to confer beneficial effects against diseases, few, if any, possess the broad spectrum of salutary influence as does cardiorespiratory fitness. Its standing in the pyramid of protective pathways is thus exceedingly high. Third, cardiorespiratory fitness can be improved by regular exercise. This speaks to how modifiable behaviors and lifestyle may readily contribute to our overall well-being and health. Our second highlight this month is a review article entitled Diagnosing Peripheral Neuropathy in Patients with Alcohol Use Disorder. It is authored by Dr. Pritikanta Paul from the University of Illinois at Chicago in Illinois, and colleagues from Touro College and Osteopathic Medicine in Harlem, New York, and Mayo Clinic in Rochester, Minnesota. In the United States, the prevalence of alcohol use disorder exceeds 11% of the population in individuals 18 years and older. In the present review, Paul et al. Addressed the issue of peripheral neuropathy in alcohol use disorder from three perspectives: clinical presentation, underlying mechanisms, and the biases that may exist against patients with alcohol use disorder. A major challenge in diagnosing alcohol-related peripheral neuropathy arises from the fact that there are no pathognomonic features or biomarkers for this diagnosis. As pointed out by Paul et al., peripheral neuropathy in alcohol use disorder tends to arise from chronic heavy alcohol intake, and while its symptoms may be heterogeneous, it is generally a mild, gradually progressive disorder with discomforting or frankly painful symptoms. It largely involves sensory fibers, and generally it does not significantly compromise movement. Such manifestations of alcohol-related peripheral neuropathy resemble chronic idiopathic axonal neuropathy thereby underscoring the diagnostic difficulty that may be encountered. Indeed, other diagnoses for peripheral neuropathy in patients with alcohol use disorder should be sought if the phenotype is severe, rapidly progressive, or if it includes autonomic dysfunction. The mechanisms underlying alcohol-related peripheral neuropathy include thiamine and other vitamin deficiencies, direct toxicity of alcohol, for example, resulting from impaired trophic factor signaling, or from contaminants such as lead. Finally, Paul et al. Emphasize, as is true for patients with drug addiction in general, healthcare professionals commonly hold negative attitudes and other biases towards patients with alcohol use disorder, perceiving them as morally weak and flawed in character, rather than recognizing them as unfortunate victims of addiction. Such stigmatization by healthcare professionals not only deprives patients with alcohol use disorder of empathetic support and care, but may also compromise diagnosis and management. For example, such prejudice may all too easily and dismissively and wrongly ascribe peripheral neuropathy to alcohol use disorder, rather than objectively considering and searching for the true underlying cause. This delays establishing the correct and potentially treatable diagnosis, or misattributes the neuropathy to alcohol. Paul et al. Importantly provide not only a timely and invaluable overview of alcohol-related peripheral neuropathy, but underscore how biases and prejudice may significantly compromise our assessment and management of patients. You can access these highlights and editor's choice articles free of charge during the entire month of August. Please visit our Mayo Clinic Proceedings website at www.mayoclinicproceedings.org, where you'll find our online-only features and many news stories posted in News from the Editor carousel on our website homepage based on articles published in Mayo Clinic Proceedings. You will see other free content as well as articles published online in press. You will also find links to our social media by clicking the links at the bottom of the home page to follow us on Facebook, X, formerly known as Twitter, and YouTube. On our YouTube channel, you'll find full-length author interviews called Insights, and our Mayo Clinic Proceedings 60 seconds video article synopses. Our website also includes our Mayo Clinic Proceedings issue summary and Author Insight podcast recordings, which are available from our website at our homepage as well as through iTunes. As always, we greatly thank you for your interest in and your support of Mayo Clinic Proceedings. We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.